Hello, dear friends. Welcome in this live session. So, we are going to start today a very important nosode, Anthracinum. So, we will discuss every point, everything, so we can use this remedy in our daily routine practice. First of all, Anthracinum is a very, very important remedy, and it is indicated in conditions of boils and boils like eruptions. If the patient complained you that, Doctor Sir, I have a one boil, and that boil is come time to time. One boil came, it will be cured. After that, when it is completely cured, then again one boil, completely cured, then again one boil. This is the indication of arnica. जहां पर एक बॉयल पैदा होता है, ठीक हो जाता है, फिर से आ जाता है, फिर ठीक होता है, फिर से आ जाता है, आर्निका. अगर बॉयल्स आर इन ग्रुप, सल्फर. But if these medicine failed and having a very, very peculiar characteristics, then we can use anthracinum. So this anthracinum is indicated in all condition of boils and boils like eruptions, like in acne in some form and in carbuncles. And anthracinum is a remedy which is introduced by Dr. Lux. He experimented long before the posture. And the most important key feature of this remedy is succussions of the boil. बॉयल्स का बार बार आना, बॉयल्स का बार बार आना, एक हो गया, दूसरा हो गया, मेडिसिन दी, कोई फर्क नहीं पड़ा, फिर से वापस आ गए. दिस काइंड ऑफ सिचुएशन. और कार्बंकल्स बार बार आना, बार बार आना. एंड द मोस्ट इंपॉर्टेंट and characteristic feature of that boil is burning. Terrible burning. Terrible burning in carbuncles. बहुत जलन हो रही है, बहुत ज्यादा जलन हो रही है. और burning, if there is a burning, 3 remedies always keep in mind. First is arsenic. If arsenic failed, anthracinum. And if anthracinum failed, euphorbium. Especially when the eruptions having a burning sensation. Terrible burning, like a live coal. And other thing is stony hardness, swelling in the region of right lower jaw and submaxillary gland. Even this is suggested in cancer too. Cancerous conditions. And what Allen says, in carbuncles, malignant ulcers and complained with ulceration, स्लफिंग क्या होता है कि जब ऊपर की जो स्किन है वो उतरती है, जैसे सांप केचुली उतारता है उसी तरह से स्किन ऊपर से निकलनी शुरू हो जाती है. एंड इनटॉलरेबल ना बर्दाश्त होने वाली बर्निंग, intolerable burning. In carbuncles, in malignant ulcers, and any complaint with ulceration है वहां पर, स्लफिंग है, ऊपर की स्किन निकल रही है, एंड इनटॉलरेबल बर्निंग. And when arsenic or best selected remedy failed to relieve the burning pain of carbuncles and malignant ulcer, anthracinum. कैंसर है, इरप्शंस है उसके ऊपर, जैसे इरप्शंस होती है तो वहां पर बर्निंग है, आर्सेनिक देने के बावजूद भी वो बर्निंग जा नहीं रही. आफ्टर गिविंग आर्सेनिक the burning will not fade out. Give anthracinum. Hemorrhage, blood oozing from the mouth, nose, anus, sexual organ, and what are the characters of the blood is black, thick, tar-like, and rapidly decomposing like croton tig. The same type of blood type in croton tig. Septic fever. And what is the septic fever condition? One thing you always noted in your notes, whenever is nosodes is indicated, the patient should be lack of energy. कोई उसमें जान ही नहीं है. जब भी नोसोड इंडिकेटेड होगी इस तरह की केसेस में, पेशेंट की सबसे बड़ी कंप्लेंट यही होगी कि डॉक्टर साहब उठा ही नहीं जाता, इतना जान ही नहीं है शरीर में. फीवर के कारण डॉक्टर साहब इतना बुरा हाल हो गया है कि मैं उठ ही नहीं सकता, I'm not able to get up, I have no energy, पैरालाइटिक वीकनेस, बहुत एक्सट्रीम वीकनेस. सेप्टिक फीवर विद रैपिड लॉस ऑफ स्ट्रेंथ. डॉक्टर साहब कल फीवर हुआ है, आज इतनी बुरी हालत है कि उठ ही नहीं सकता और मुझे किसी की हेल्प लेनी पड़ती है उठने के लिए, इतनी ज्यादा वीकनेस. लॉस ऑफ स्ट्रेंथ, sinking pulse, delirium, fainting, pyrogenums. Every nosodes have this character, asthenic state. Means loss of vital energy, loss of strength, no power. Gangrenous ulcer, phalon, carbuncles, erysipelas of malignant type, cancerous conditions. Phalon, the worst case with sloughing and terrible burning pain. इसमें क्या होता है कि ये जो पैड है इसमें इन्फेक्शन हो जाता है, स्वेल हो जाता है, पस बन जाती है, बर्निंग हो रही है, फुली टाइट है. आप इसको टच करके देखोगे तो आपको महसूस होगा कि यहां पर ऐसा कोई भी स्पेस नहीं है जिसको जो हार्ड ना हो, हार्ड स्टोन लाइक सेंसेशन। और यहां की स्किन जो है नेल की, जो नेल बेड है उसकी जो स्किन है वो उतर रही है यहां से और बर्निंग हो रही है, बहुत जलन। वर्स्ट केसेस स्लफिंग, टेरिबल बर्निंग पेन जिसमें आर्सेनिक, कार्बोलिक एसिड एंड लैक्टोसिस है। Malignant pustules, black or blue blisters, often fatal in 24 and 84 hours. ऐसे malignant pustules जो कि ब्लैक या ब्लू कलर के हो जाते हैं और 24 से 48 घंटों के बीच बीच एक्सट्रीम पर चले जाते हैं, इस तरह के केसेस। Carbuncles with horrible burning pain, discharge of offensive pus. But if there is a case of carbuncle, burning should be there, horrible burning. And if it is a case of arsenic, heat is ameliorated by heat. Horrible burning, dissecting wound, especially if tendency is become gangrenous, septic fever, mark prostration. आप किसी भी नोसोड को पढ़ेंगे तो सबसे इंपॉर्टेंट वहां पर एक चीज जो बहुत कॉमन रहेगी वो रहेगी मार्क प्रोस्टेशन। बहुत ज्यादा वीकनेस, लॉट्स ऑफ पेशेंट इज अनेबल टू गेट अप, extreme weakness, patient is not able to get up their own, loss of strength, burning pains, arsenic, anthracinum, lots of burning. Mark prostration, the same mark prostration you will find in arsenic. In arsenic, he doesn't know he's weak that enough. When he moved, then he realized that he's weak. He's prostrated. But in Nosodes Anthracinum, the weakness is extreme. Somebody help him to get up. Somebody help him to get up. Second important thing is septic inflammations with absorptions of pus and other deleterious substances with burning pain and great prostration. Same thing. Every time when you have a case of eruptions and patient says, I have a burning like a coal, burning pain, burning boil, burning carbuncle, burning ulceration, burning malignant ulcer, any cancer having a burning, arsenic, anthracinum, and if these both remedy fail to relieve that burning, go for euphorbium. And what euphorbium says? Euphorbium says terrible burning pain as if live coal were on or in the parts of cancer, carbuncles and erysipelas when arsenic and anthracinum failed to relieve. If these two medicine, arsenic and anthracinum, failed, And you have another options, euphorbium. It will relieve that burning pain. And Herring says, what Herring says, he says, to call a carbuncle a surgical disease is a great absurdity. An incision is always injurious and often fatal. A case has never been lost under the right kind of treatment, and it should always be treated by internal medicine only. Only internal medicine give you a relief, but it should be on correct way. Then we can find the cure. So that's why Herring, Hahnemann, Schwann, Taylor, Forbister, these are the well-practiced homeopaths. If we read them, we can get that much information to treat our patients. And this is, anthracinum is very similar to arsenic, carbolic acid, lactic acid, cecal, pyrogen in malignant and septic condition. And what is the positive diagnosis? If you have 3 things in your hand, in any case, first, indurated vascular inflammation. First, indurated vascular inflammation. That vascular inflammation should be indurated. Stony hardness, sloughing, burning. Second, intensive burning pain. इतना बर्निंग, इतनी जलन जैसे कि a live coal on the part, internally or externally. That much of burning. And it is intolerable. It's not tolerable. Intolerable. And the third is irritating and fetid secretion. What kind of secretion? Tar-like. If there is ulcerations, tar-like, blackish blood. If you have these 3 things in the hand, you can prescribe anthracinum. A dynamic condition, excessively sensitive person. And the patient who becomes suddenly septicemic with asthenia, emaciation, intense thirst, developing towards a state of prostration. इस लेवल तक चला गया है, इस लेवल तक उसकी एनर्जी खत्म हो गई है कि अब उसमें जरा सी भी जान नहीं बची. He had no strength, no power, no vital energy. That much prostration. And this type of prostration you will find in all the nosodes. One by one when we will discuss, we'll see that the amount of prostration in the patients. And these few things are suggested by our books. And one more thing, any dissecting wound, especially if the tendency is to become gangrenous, septic fever, mark prostration. First, The key indication is succussions of the boils or carbuncle. हो गया ठीक हो गया, आ गया ठीक हो गया, फिर आ गया फिर ठीक हो गया. Succussion one by one after one after one, boils, carbuncles first. Second thing, intolerable burning. Third thing, stony hardness. Intolerable burning, succussion of the boils. And the fourth thing is fetid, offensive discharges. In case of anthracinum, tar-like, blackish blood, blackish oozing, tar-like oozing. These kind of keynotes, if you have, don't forget anthracinum. And if arsenic failed, anthracinum. If anthracinum failed, euphorbium. And the most important is prostration, extreme paralytic prostration. What is paralysis? When we are not able to use our hand. No power. And what is paralytic? Paralytic is the condition very similar to paralysis. Body have no strength, no vital energy. We are not able to get up by own. We need help. Somebody help us to get up from the bed, from the chair, to eat, to drink. Somebody help us. If something is in our hand, we are not able to pick the stuff. We don't have any strength. We don't have any strength in our grip. That much of prostration is present in anthracinum. So today we will discuss anthracinum. We discuss few keynote of the anthracinum. So one by one we will discuss all the nosodes. And if you have any suggestion, if you have any questions, please ask. Then we will discuss each and every question first, then we will discuss the next remedy. So from tomorrow we will discuss the differentiation. In evening class, I will try to differentiate these remedies so we can have a very clear view how to differentiate anthracinum from the other remedies, and so we can use this remedy in our daily routine practice. Thank you so much.